originally negative. As you can see, I'm using iodine to clean the area. Patient's position is right lateral side. He's a little angulated, but he's a little confused, hard to follow instructions. Nurse getting ready on the back side to help me in case the patient moves or whatever. I'm localizing where I'm going to numb the area. Now we usually use the L4-5 or L3-4 space. We use the iliac crest, the hip bone, to direct us straight down to the spot where we feel the space, and then one space right above that. This is just lidocaine, so there's no real big importance if the patient moves a little bit or not. We just inject like half a cc just to flare the skin and provide some numbing at the site. Then we go with a bigger needle, longer needle and thicker needle, and then we withdraw to make sure we're not in a vascular space, and we inject. We go deep, pull back, inject. We go a little deeper, pull back, inject, and we go the whole length of that needle. That's at least 2 inches deep numbing medicine. We use lidocaine 1%, no epinephrine, and we just continued that all the way through. Now this patient was extremely perfect for this case. You could feel the spaces very well. You know exactly where you were going. Here, patient felt some pain, so we stop. We give the medicine some time to work, and then we inject medicine as we come out of that track. The area has been cleansed. This is actually the lumbar puncture needle, the spinal needle, and we use that same space, and we just go perpendicular to the skin, pointing towards the belly button, the navel. And I pull back to see if I'm in that space. I haven't gone deep enough, so I put it back in, and I go in a little further, and there it is, a fluid, clear fluid, what they call a champagne tap. You can see right there the water drop just accumulating. Spinal fluid should be completely clear, just like water. If it looks turbid or yellow or thick, then we think there's a problem going on. Either they have meningitis or they have a bleeding and so on. Now this spinal needle is very thin. The advantage of a thin spinal needle is less likely to cause trauma and post-spinal headaches. Obviously less pain at the site, less likelihood to cause bleeding or problems. But the disadvantage is that it flows very slow. The drops just fall very slow. So I have this at 4 times the speed. Those drops are falling in, and it's just a slow procedure. Those drops falling back in the tube. You can see right there. Boop, boop. And this particular patient, the stab was clear. There was no organism seen. There was no very little protein, no cells. So we think it was a clear tap, and patient did not have meningitis. Patient was admitted regardless because of his history. He had a new onset seizure, and we were worried about stroke. The CATs can show a small subthalamic stroke. You can see right there the drops still falling in. And again, this was the best example of a procedure of a lumbar puncture I could have hoped for. First stick, no multiple tries, no going different spaces. Truly, it was perfect. And I thank the family and the patient for letting me do this. Again, remember to wipe off every piece of iodine. You don't want to have chemical burns on the skin. And then the most important part, place a band-aid in